Welcome to Habitual Excellence. I'm Mark Graban from Value Capture, and our guest today is Paul Pejsa. He is Network Director of the Catalysis Healthcare Value Network. Paul, how are you today?
I'm doing great, Mark, and thank you for the opportunity to share today. I appreciate getting some of the word out on what we've learned through this crisis and lean management systems.
Yeah, well, I'm glad you can share that with us today. And before we dive into that, can you maybe first introduce yourself and Catalysis and the Healthcare Value Network, what those are for context here?
Sure, can do, Mark. So a little bit about my background. I've got 30 plus years of experience across various industrial sectors, service sectors, and about the last 10 in healthcare. About half of my career has been in a variety of process improvement roles. So went through Six Sigma with GE as a master black belt, and then with Toyota and some of the Shingijutsu group, learned the basic elements of lean, and currently in Catalysis under the leadership of Dr. John Toussaint and Kim Barnes, I've been fortunate enough to be exposed to the real details of a lean management system and how that gets deployed in this very complex industry of healthcare. Leading the Catalysis Healthcare Value Network, which is a peer-to-peer learning network of 70 members, anywhere from small clinics to academic medical centers to very large regional medical centers. We've been able to see the maturation of management systems, and most recently, we've been able to see how those have reacted and responded to this, very unfortunate COVID-19 crisis that we find ourselves in.
Yeah, and before we dive into that, I'd also mention to the listeners, Catalysis is a not-for-profit educational institute, and if you want to learn more about them, their website is createvalue.org. If you want to learn more about what they're doing, Healthcare Value Network and otherwise. But Paul, in your role, you have the opportunity to talk to many health systems. What are some of the examples, as you were sort of teeing up for, examples of health systems that are more successfully managing this COVID-19 crisis?
Sure. What we're finding, Mark, is that the length and breadth of their lean transformation seems to be a strong indicator of their success in responding to this crisis. A couple of examples of that, where I see organizations that have a fully developed set of tiered huddles, anywhere from frontline staff to executive level. The communications in this crisis seems to have flowed more quickly, both up the chain for removing barriers or highlighting very urgent issues, as we've experienced through COVID, and also to flow down key communications to staff when there are immediate changes. And certainly all of us have seen, whether it's through the government or regulatory bodies, almost hour by hour, the responses and the advice on how to manage this crisis are changing. Those can flow very quickly if you've got a fully developed and active tiered management system that truly engages both the staff and the executive. And we're finding in those cases that levels of staff stress can be lower, and the executive's response to immediate issues seems to be more measured.
Mm-hmm. And before looking at some of the specific examples, can you elaborate a little bit for listeners who might not know what you mean by a lean management system, or what these health systems mean by lean management?
Yeah, absolutely. So when we think about a lean management system, there are a number of key elements that go into that. And some of the very basics would include, do you have a huddle? Do you gather your team together, whether it's at the frontline staff or the director level or at the executive level? Are you coming together on a regular basis with some sort of a structured 10 or 15 minute stand-up? Do the managers and directors and executives have some sort of a status sheet where they do a one-on-one check-in on key issues? When we think about what gets discussed in a huddle, do they have performance metrics? And are they leading metrics, or are they simply looking at lagging metrics like CLABSI or CAUTI rates or 30-day readmissions? And have those metrics been developed with the frontline staff? Do those metrics get discussed in some sort of a review session on a regular basis? And if you do have performance reviews with those metrics, is the leadership team engaged? Are they asking good questions? And in order to ask good questions, of course, they have to have some sort of leader standard work that would take them into Gemba to go see, because you can't ask good questions if you don't understand the operation. And following on to that, do they have countermeasures? So if a metric goes red, mature lean management system would treat that as an opportunity. The team that's managing that metric would develop countermeasures, and the leadership team that's listening to that review would be offering help. At the very fundamental level in a lean management system, you would find A3 thinking broadly deployed. So independent of what you call that A3 tool, is there true PDSA thinking? Do I think about the left side of an A3? What's the background? Do I think about the right side of the A3? What are my actions in that A3? And then, like most lean systems that you and I, Mark, would see in many organizations, are they using the fundamental tools, and do they have standard work that actually tells them how to operate on a day-to-day basis? If you put all those pieces together and they're all functioning, I would call that a very mature lean management system.
Mm-hmm. And you mentioned PDSA, plan, do, study, adjust. I mean, I think that mindset has been critically important for organizations I've talked to, because there has been so much change, so many new requirements and new ways of providing care and protecting people. That idea of rapidly putting together a plan and then doing or testing, I think is more beneficial when people then close the loop to actually study the effectiveness of what we're trying, all of these new practices, to see if it's really effective so that we can adjust as needed without feeling the pressure to say, oh, well, we put together a new process. It must be perfect. Let's move on as if it is. That experimental mindset, I think, is really important. You're probably hearing a lot about that.
Yeah, absolutely, Mark. And here's the difference. If you're really doing PDSA, then even in a crisis, when you make a change, as you stated, you take the time to study and adjust. Even if it's, hour by hour or day by day, you're still closing that loop. What happens in a less mature organization that either has a very young lean management system or doesn't have one at all is we tend to fall back into firefighting, which, as we both know, is the legacy of healthcare problem solving. It's what we call small p, big D. I make a little plan, I go do a bunch of stuff. I don't circle back, I try something else. And you can see that in a crisis, if I'm just going through PD cycles, I may never really get to the root cause of what's driving this element of the crisis. And that could be, failure to acquire or clean my PPE. It could be bed allocation. It could be testing. If you're not closing that loop, then you will miss key lessons that will prevent you from successfully getting through a crisis, whether it's COVID or any other.
Yeah. So I know you've got some specific examples of some organizations that you can share with us today. What's the first example that you can tell us about?
Sure. The one I'd like to share that I think is perhaps the most important, one of our network members is Bryan Health in one of my favorite cities in the Midwest, Lincoln, Nebraska, because they have a very well deployed and mature management system that ties back to fundamental principles, which is something we haven't covered yet, but I want to touch on briefly now. If you've got a lean management system, part of the bedrock of that management system are some of the principles that guide our behavior, especially as leaders. Two of the most fundamental principles that go back to the Shingle model that we're all familiar with is respect for the individual and leadership with humility. Those two principles have been deeply embraced by Bryan Health during this whole COVID-19 crisis, and the behavior led them to was a commitment to no layoffs and a commitment to the staff having exactly the PPE they needed in the condition they needed it, where they needed it, in adequate supply. And as a result, through this COVID-19 crisis, through their lean management system, Mark, they actually saw employee satisfaction increase, which, if you think about it, the crisis and what you and I see on the news every day or read in the paper, awful lot of stress. And having a spouse who is a primary care provider, I can tell you that there's an incredible amount of stress and apprehension. And yet this healthcare system actually increased employee satisfaction during this crisis, which hit the Midwest perhaps not as hard as the coasts, but certainly caused a lot of stress within the staff and within the providers.
Yeah. Yeah. Well, there's that stress, or there's that anxiety of not knowing what to come, and feeling supported from a safety perspective and from a financial perspective. I mean, that's all right at the base of Maslow's hierarchy of needs to help eliminate that stress, allows people to shine and excel in patient care and everything else they do, I think.
Yeah, absolutely. And if the provider feels comfortable, then certainly that translates over to the patient. In another case, in a pediatric case, our friends at Children's Mercy Hospital in Kansas City, they have rapidly matured their management system, in particular, the communications that flow through 5 tiers of huddles. They of a total of 300 huddles deployed within their main hospital in Kansas City. And due to the crisis, they took 1/3 of them, 100, and turned them into virtual huddles. So because of the necessity of distancing and the way that care is being provided and to keep their providers safe, 100 of those huddles became virtual. And because the system was mature, they didn't miss a beat in communications. And what the employees are reporting is that they feel well communicated to by the executive team led by CEO Paul Kempinski. And the executive team feels like they understand on a day-to-day basis what are the key barriers. And they've defined the levels of escalation in such a way that the right problems are being solved at the right level. And that's another fundamental piece of a lean management system. You want to drive problem solving down to the lowest level possible, but you and I both know we can't solve every problem at the front line. There are barriers that must be removed at different levels. Mm-hmm. So a piece of their rapid maturation was to devise a process by which they would determine what gets solved at staff level, what gets solved by the managers, what gets solved by the directors, and what goes all the way up to the CEO huddle to be solved. And they're finding that things get solved rapidly as a result.
Yeah. Yeah, and that's interesting hearing about that balance. You mentioned earlier, Dr. John Toussaint, is founder of Catalysis. We've both heard John talk about the shift in his own leadership style when he was the CEO, and what he teaches others is the leaders can't be all-knowing and all-powerful, having all the answers. And so there's this balance, like you're saying. Frontline leaders have a really important role to be supportive, but they can't delegate everything, like you were saying. There are some problems the frontline staff is perfectly positioned to address, and some things are more systemic, bigger picture issues that the executives or middle management leaders need to really be directly involved in.
Yeah, absolutely. And let me give another example, because as you and I both know and have taught and advocated for many years, standard work is part of the foundation of lean. If there's no standard work, there is no improvement. It's all variation. So one of our network members, Nebraska Methodist Health System in Omaha, as part of their COVID-19 response, they spent time with their improvement team to create an operational readiness plan that not only creates the standards to manage the crisis, but created with a mindset towards the next crisis. Because you and I both know there will be another pandemic, there will be another crisis. It's simply a matter of time. So, with an eye towards that, the Nebraska Methodist Improvement Team created a full operational readiness plan that has them thinking about what happens the next time. How do we better manage so that we can be more efficient, more effective, and more lean when the next crisis hits? And because we've got this peer-to-peer learning network, they have very graciously shared that across the full network so that others can learn. And really, that's another piece of these lean management systems that we advocate, is that when you learn a best practice, share it. If you've got a lesson learned where you've stubbed your toe, share that as well, because sometimes we learn as much from the failures as we do from the successes.
Yeah, that's very true. And I think there's at least one other example you had, but along these lines. But you mentioned Bryan Health and respect for people and not laying people off. I see the headlines flow through every day from some of the healthcare publications and their news summaries, and you see a lot of headlines about layoffs and furloughs. But it's great to see not just Bryan Health, but one other that I had heard about and personally want to give some recognition to is UMass Memorial Healthcare, where their CEO, Dr. Eric Dixon, who's really committed to, he really used lean management system as a turnaround mechanism for the health system when he came in and took that job. But I'm looking at a news story from May 13th. UMass Memorial CEO commits to avoiding layoffs and furloughs. And, even though it says, yes, they've had a financial hit, they feel like they're doing the right thing for the long-term perspective. And like, to me, that's an important element of lean thinking. If for people who are familiar with the book, The Toyota Way, that lays out 14 principles of Toyota, or, we can call it lean thinking. Principle number 1 is focusing on the long term, even at the expense of the short term. So I admire when leaders and organizations are willing to do what they think is best for their people and best for the organization in the long term.
Sure. And I think, one of the aspects of Dr. Dixon's behavior that he talks about very honestly is his need to practice leadership with humility, to go to Gemba, to learn the real situation, which is what we should do as leaders. Before we act, we should go learn. And I think some of that humble leadership is what you see reflected in the actions that he and his executive team took at UMass Memorial, that they want to preserve their staff. They're looking for the long term. If you think back to the very origins of the Toyota production system that Leiker covers in his books, it was originally called the respect for people system, because what Toyota understood very deeply was that if we're not respecting our people, we won't engage them in problem solving. If we don't engage them in problem solving, then almost by definition, we don't have Kaizen. We don't have that day-to-day improvement.
Yeah, and I think people's commitment to organizations like UMass Memorial and others that are finding alternatives to layoffs and furloughs, that's going to help reduce turnover and improve performance and a lot of other dimensions. But you've got a couple other examples that you're able to share with us here as well, right?
I do. And so I also want to highlight our friends over at Integris Health in Oklahoma City. So under the leadership of CEO Tim Pearson, using some of the skills that he honed when he was leading North Division at Intermountain Health, they rapidly created a lean management system about a year and a half ago. And one of the bedrocks of that is the creation of standard work. So their vice president for continuous improvement, Lisa Olensky, at the very start of the crisis, worked with their medical leadership to create standard clinical guidelines for treating COVID-19 patients. So fairly large document that they almost literally created overnight and then shared very broadly across all of their 13 hospitals. and then went ahead and shared it across our entire healthcare value network system that gave very detailed standard work on how to manage these very new challenges of COVID-19. And they adjust that standard work on a daily basis through their continuous improvement team. So it really highlights the need to first develop standard work, and then through the process of Kamishi or audit of standard work, to interrogate it on a regular basis to understand, is the standard work still giving us what we need, or do we need to adjust it? And so under Lisa's leadership, they have processes to very rapidly adapt that standard work as the crisis unfolds and frankly continues to unfold throughout our country and across the world.
Mm-hmm. And then going to another part of the country, you had an example from California as well, right?
Sure. So really fantastic example. Our friend Jeremiah Hargrave at Torrence Memorial Medical Center, and Dr. Toussaint is actually writing about this as we speak. They had a shortage of PPE. They had a number of engineers on Jeremiah's improvement team, and they were able to use 3D printing techniques to create some of the face shields that were required. Also using simple things like clear plastic dividers to help create the PPE that people needed, rapidly deploy it, and essentially create a little factory within a hospital to first create that PPE, and then on a day-to-day basis, increase production using, no surprise, lean techniques to interrogate the process and improve the process. So, real success story, responding to the need. We need PPE, smart people on the improvement team that had the skills to actually stand up a process, understand how it flowed, and then improve it so that, on a day-to-day basis, they are improving their output of quality PPE tenfold. Really an amazing story.
Yeah, that's great. And, you've got these examples. I was wondering if you could talk a little bit more, about the Catalysis Healthcare Value Network. When I, it's been going on more than 10 years, and I was there and involved a little bit in some of the early days when the network was smaller and just getting started. But I know one of the guiding principles has always been this idea of sharing and collaborating across organizational boundaries. So I was wondering if you could just sort of touch on that a little bit more. You've got all these great examples, and it's great that you're sharing them publicly here. But
Sure.
Can you talk a little bit more about the learning and sharing dynamic within that network?
Sure. And, frankly, Mark, we've been very blessed. We've got fantastic members of the network that are willing to share. I think the very fundamental thinking is that if we can learn together as peers, we will more rapidly transform this very complicated industry of healthcare that we've made a big part of our lives, Mark. So on almost a day-to-day basis, we will get requests coming in from a network member, whether it's during the crisis around PPE or a more general question around standing up a lean management system. And because we have so many people doing experiments across these 70 or so members, within sometimes hours, we can connect, say, Children's Mercy Hospital in Kansas City to Seattle Children's Hospital in Seattle to learn a best practice on huddling with physicians, for example. So very, very rapid cycles of learning. And through this crisis, on a weekly or even a bi-weekly basis, we have network members holding up their hands to say, hey, I've learned something about staff stress or how to redirect unproductive behaviors. Southern Illinois Health down in Carbondale, Illinois, has given one Zoom sharing session on how to reduce staff stress, with over 70 individuals attending that Zoom meeting, asking questions back and forth. Southern Illinois Health sharing their best practices and their presentation. And we'll actually do a follow-up session next week with Southern Illinois Health. And we're going to try Zoom breakout rooms, Mark, for the first time to see if we can actually do some training, do a breakout session, then have people come back and report out, something that you and I have both seen in live Gemba visits. We're going to try it virtually, and we're going to see how the experiment goes. And as a minimum, we'll learn something,
Yeah.
and we can study and adjust. But we think it'll be successful. And, we're very thankful that these technologies exist for us, like Zoom, that we can actually do things virtually during this crisis that we used to do very comfortably face to face.
We're all having to adapt, and I guess so. Plan, do, study, adjust is happening a lot during this era. What I hear you saying is that there are principles, there's leadership, there's diligent effort. That there's no silver bullet or magic beans or instant pudding or whatever phrase you might use when it comes to lean management systems and dealing with a crisis or regular ongoing operations, right?
Yeah, that's true. But if there is one, I'll use your phrase, if there is one instant pudding that makes it work, I'm going to go back to a name that you shared a few minutes ago. I think leadership of CEOs like Dr. Eric Dixon, who embrace the principles, not only drive the behaviors in themselves, but expect them out of their direct reports, is perhaps the key element. And you and I have both seen where there's executive engagement, especially from the CEO. If she or he is out there in front leading it, that transformation can happen both rapidly and it can be sustainable. Without that, it can be very difficult to sustain. It can revert back to a tool-based or a project-based approach. But where we see network members with the CEO out in front waving the flag, then I think we have a lot of confidence that not only will they transform into a full lean management system, but they will sustain. And in particular, in some of Dr. Toussaint's latest work, if they're engaging the board of directors, so the board clearly understands what is meant by a lean management system and what it takes to lead it, then we have good hope that when the next CEO is brought into that organization, that he or she will continue that lean journey.
Yeah. Well said. So, Paul, thank you for sharing, this good news from what's happening out there in the health systems you've been talking to. Our guest again has been Paul Pejsa. He is network director of the Catalysis Healthcare Value Network, and you can learn more at their website, www.createvalue.org. As Paul mentioned, there's a lot of great blog posts and white papers, and Catalysis's own podcast called The Lens. There's a lot of great information that's inspiring and educational. So I would definitely recommend that to everybody as well. So Paul, again, thank you, and hopefully we can talk again sometime. I'm sure there'll be more lessons to be shared down the road.
Great. Mark, thank you very much for the opportunity to share. I hope our listeners can take something away from this that they can go experiment themselves, and we'll look forward to the opportunity to continue this conversation. Thank you.
Okay. Thanks again, Paul.
Bye-bye.